Any extension of the Children's Health Insurance Program, or CHIP, is just that, an extension. With no long-term solution in place, the future beyond that is murky. The Night Beat's Michael Perchik joins us live with more on that. Michael?
Mike, as you just mentioned earlier this evening, lawmakers on Capitol Hill working towards approving CHIP funding nationally through the end of March as part of that stopgap measure to avoid a government shutdown. While that does provide some extra insurance for Central Texas families, that lack of a long-term plan is nerve-wracking.
For our family, it's a lifeline.
A lifeline with a seemingly tenuous rope. As lawmakers grapple over the future of the 20-year-old CHIP program, families like the Hongs are left in limbo.
One of my kids has appointments weekly for therapy and psychiatry monthly. And then my daughter also has asthma, so she needs inhalers and nebulizers and all of that.
Elizabeth Hong and her family live here in Austin. A mother of 3 and a guardian of a 4th, Hong and her husband both work. Before moving to Texas 4 years ago, she was a special education teacher. But with her children's appointments, she's had to forego opportunities to provide care.
There's no way I could hold down a job making more money and still be able to take them to see the doctor, to see the therapist.
CHIP was designed for families just like the Hongs. The federally funded program is meant for families who make too much money for Medicaid, but not enough to afford private insurance. Stacey Wilson, the president of the Children's Hospital Association of Texas, explained its success.
The uninsured rate for children has gone down to single digits, which is amazing in a state that is, we have a lot of small employers who don't offer coverage because it is very expensive.
Funding has traditionally received bipartisan support, a point that gives many hope it will once again. But it's also provided renewed concern about the ever-growing delay for a program that's funding ended at the end of September.
Our kids are very important, and they're not pawns in a political game, and so it's really important that we prioritize.
Here in Texas, 400,000 children and 36,000 pregnant women utilize CHIP funding nationally. Nearly 9 million children use those funds. Some of the benefits covered by CHIP here in Texas include doctor's visits, dental care, x-rays, eyeglasses, and hearing tests. I'm Michael Perchik, KVUE News Night Beat.